afternoon. This is Dr. Martin, and today we're speaking to Diva. Diva is my afternoon co-op, and she has a wonderful presentation for you on branched retinal vein occlusions. So Diva, take us away.
All right. So you might be asking, what is branched retinal vein occlusion, or BRVO for short? It occurs when there is a blockage of the veins carrying blood away from the nerve cells in the retina. This is a blockage in the smaller veins as opposed to CRVO, which is central retinal vein occlusion, which occurs in the main vein of the retina. The vein blockage results in blood and fluid spilling into the retina, which may cause swelling of the macula, and nerve cells may die and cause loss of vision. So, to give a little bit of an image, the retina is right here, and these are the retinal blood vessels where the blockage will occur, and then the central retinal vein is right here in the optic nerve, but for this presentation we'll focus on these blood vessels right here. And another picture, just to give you some more perspective, with branched retinal vein occlusion, the kind of blood spilling will occur kind of in one spot, as opposed to the central retinal vein occlusion, which will occur all over, and the edema shows signs of swelling right there and right there. So symptoms include a sudden and painless loss of vision, blurry vision, floaters. If it's not in the center of the eye, it might go unnoticed, and almost always only in one eye. Risk factors include if you are over the age of 50, if you have high blood pressure, if you are diabetic, if you have glaucoma, or if you have hardening of the arteries, which is atherosclerosis. How to reduce the risk: maintain a better diet, exercise, trying to keep an ideal weight, so somewhere in the BMI, and abstain from smoking. How can it be diagnosed? Two of the main ways. There can be a dilation done by your eye doctor to view the retina, and an OCT machine can provide images of the central retina, which allows for detection of macular edema and fluid outside of the macula. So what that would look like, for example, is something like this. So here you have the retina, and here you have the macula, and then here you can see the blood spilling. Basic forms of treatment include, well, first of all, it can't be cured, so if it happens once, it'll be there forever. You can seal off any blood vessels that are leaking into the retina using a laser. Medication injections in the eye can reduce swelling of the macula, but the main goal is to just keep your vision stable, because there's really nothing else you can do. So some facts and statistics. Visual acuity for BRVO and CRVO patients typically ranges from 20/40 to 2200. Usually improves in patients with branched retinal vein occlusion, but not central retinal vein occlusion. Over 60% of patients, treated and untreated, maintain vision better than 20/40 after 1 year. Retinal vein occlusion was recognized at least as early as 1855, so that's when it was discovered. And branched retinal vein occlusion is 3 times more common than central retinal vein occlusion. And nearly 75% of BRVO patients already have been diagnosed with hypertension. And those are my sources.
Awesome, Diva. You did an amazing job. Thank you so much for sharing all that good information with us.